All right. Hello, everybody. We're here for another career interview. And this time we have with us Elizabeth Conward, Liz. And of course, you know me, I'm Liz Vincent. I'm the Campus Ministries Director for New England Franco-Haitian Youth Federation. And we're going to get right into our questions. Before we start, I just want to say thank you to Liz for deciding to do this interview and to share her journey of how she got to where she is. So, with that, we'll get started with the question. Tell us about yourself. Tell us a little bit about you.
Sure. As you mentioned, my name is Elizabeth Conward. I am a licensed social worker. I am a mother of one. And I enjoy reading and writing and spending time with friends and loved ones.
That sounds great. Awesome. Awesome. Thank you for telling us about you. So, we're going to ask you to tell us a little bit more about your field, your industry. You said you're a licensed social worker. So, yeah, tell
Mhm.
us about what you do.
So the social work field is very broad and so many areas and things that you can do. I am currently working as a psychotherapist. I provide counseling to children, adolescents, couples, and families.
Wow. All right. That sounds pretty deep. And I'm sure you have a chance to tell us more about that. But
Yeah.
as a Christian, and I have to plug it in that Liz went to AUC, whoop whoop, my alma mater. Um,
Yeah.
so, as a Christian, what role does your faith play into your career?
Hmm. I think throughout the years working as a social worker, it has played a major part and major role in my career because it can get very difficult and hard working with families that are going through certain things. And I've seen and I've heard some terrible stories, some very tragic and traumatic stories. And first being able to acknowledge the blessings that I have and how I've been favored, and for some of the things that I personally did not have to go through, an experience that I've heard and seen other people go through, and allowing me to use my faith to know there's hope.
Mm.
A lot of times I have to go to whether I had to pray and ask for courage and strength to deal with certain family or certain situations. So that's definitely one way faith has played a great role. And I think because I have a Christian background and was raised in the church, a lot of times I have Christian clients, and I think that gives them a lot of comfort knowing I'm working with someone that acknowledges God and knows, that he's real and can pray with me and things like that.
Yeah, I think that's a valid point because as Christians, doing therapy, psychotherapy is something that many Christians don't tend to go to. It's changing, of course, with our generation and the next, but
Mhm.
it's great that you're able to bring that perspective for them. Would you say that you're working
Yeah.
on your purpose?
Yes, I would. And I think more and more every day I'm seeing it. I I've been working with a lot of Christians lately in my field. In fact, I think most recently I've had a few Seventh-day Adventist patients, and the idea of knowing that I too am Seventh-day Adventist, and I understand the background and the beliefs of that religion,
Mhm.
it takes a lot off of them. Like, okay, so you understand why this is a concern, or this is something I'm struggling with. And I think that from the way I even started in the field, I think it was my calling. It was what I was meant to do.
That's awesome. So what could you tell us about exactly where you're working right now,
Mhm.
and what position you have? I know you're doing psychotherapy, and what led you to exactly where you are right now. So a little bit
Mhm.
about your journey.
Okay. Well, currently, after COVID started, I was working for a clinic, a mental health clinic in Brockton. Um, the person that owned the clinic had a lot of medical issues, and when COVID started, decided she was going to sell the clinic, so she sold the clinic. And I was the clinical director at the time. And then after the clinic was shut down, I went through a process of I don't want to work for nobody else. So I started my own group practice. So currently I am the CEO and founder of my own group practice, and I recently hired my sixth clinician. Thank you.
That is awesome. Doing big things, and you know, COVID has been terrible. It's still terrible.
Mhm.
We've lost a lot of people, but God definitely brings out blessings still in the storm. So I think that is fantastic. That's wonderful that you started your own. You have
Thank you.
people doing it. Um, you know, so you can infuse your vision, your values into that clinic. So that's wonderful. Um, so
Thank you.
could you tell us about what type of education is necessary for you to be successful in your job, and what kind of training you had to do? Were there any certifications? Because you said you're a licensed social worker. So how do you get to achieve those or obtain those,
Mhm.
and any prior experience you've had?
Okay. So yes, you have to actually obtain at least a bachelor's degree um in social work, and then to get to the point as a social worker to provide psychotherapy, you have to go for your master's, and from there, for the state of Massachusetts, there are two levels of licensing that you have to obtain prior to become um, an independent social worker. And the importance of being an independent social worker is that if you want to do psychotherapy, you can work by yourself as an independent provider. You can actually open your own private practice once you are independently licensed as a social worker, versus the first level of licensing as a social worker. You have to obtain 2 years of supervision to become independently licensed, and then you have to take a second test to be independent licensed. However, many other states, depending on where you live, don't require two levels of licensing. They only require one. I believe Massachusetts is probably the only state I could think of that has, I may be wrong, but I know many other states only have one. And I always like to do this little education speech regarding counseling, because there's so many different ways you could become a therapist and a counseling, not just social work. You could go to school for psychology, you could go to school for mental health counseling. However, I like to always educate people like the differences with those roles is, as if you are into testing and doing educational testing or other psychological testing, then a psychologist is great to be a psychologist. If you are strictly interested in doing mental health counseling, getting your mental health degree is great. However, if you're looking for a field that gives you more options where you can work in a hospital, in a school, in a for-profit, nonprofit, um, overseas, like social work give you so many more options than if you're just doing one of the other two options.
Thank you for sharing that. I think that's really important. I think as
Mhm.
young people are trying to make decisions, or even older people trying to change careers, and knowing that going into social work gives them a little bit more flexibility is a great thing. So thanks.
Yeah.
Um, so as the CEO and a license of your own clinic and a licensed clinician, what's the most challenging part of your job? And then after that,
Mm,
tell us what you think is the most rewarding part of your job.
okay. Most challenging part of my job, I would have to say, listening. I see about 5 to 6 clients per day. So doing 5 to 6 hours, listening to other people's um trials, other people's trauma, it can weigh on a lot on you. And it um I had to learn to practice a lot of self-care and understanding, like, once I'm done with my last patient, to like leave it there. And I can't even say leave it at the door because I do telehealth, so I'm home. So it's like um allowing myself to not spend my entire night thinking about something that I heard and something that happened. And so that's very difficult. And also, now being the one running the clinic,
Mhm.
I'm not only hearing my patients' stuff, I have to hear my clinicians call me when they hear difficult things and trying to figure out, how do I handle this? What do I do? Um, and making decisions of how, like, when to file a 51A. Should we file a 51A? When do we do this? And so those are like the difficult parts, is trying to make certain decisions and spending hours a day listening to some very disturbing stuff.
Yeah. I cannot imagine. I mean, in education, you hear about different things, but when it's the person themselves telling you what they're going through, um, and then, as you said, having to hear it from your clinicians because now you're a business owner and you're
Mhm.
the director, running everything. Um, it could be very taxing. So
Mhm.
I know I already asked the question about rewarding, but before we get there, um, you did mention that you try to do some self-care
Mhm.
when work gets stressful. What does that look like? What does your self-care routine maybe, or how do you find ways to take care of yourself?
Um, well, now it's I don't have the typical 9 to 5, 40 hours a week with vacation time. So I have to allow myself to say, okay, you need a break before you burn out.
Mm,
And I've learned to take at least 2 or 3 days off, like every 3 to 4 weeks, where I'm like, okay, I'm gonna take vacation time as if I was working for someone else. Um, so that's been helpful. Trying to spend as much time with close friends and family, especially during the weekends, times I'm off. I don't work on the weekends. And I don't work on Fridays. So I have a 3-day weekend every weekend. So Friday to Sundays are my days off. Um, yes, I may see 6 or 7 clients Monday through Thursday, but I know Friday to Sunday I'm off. So that helps. And also, like I said, trying not to focus so much on clients when I'm off,
mhm.
when my day's over. As soon as I type a note, it's like, oh, I'm gonna have to push this out of my head to the next week. um, and sometimes it's harder than others. And also just doing typical things like going out with my kid, spending time with them, watching movies, things like that.
Yeah, that's very crucial. And I think even in COVID times, and as you said, you do telework. So the fact that
Mhm.
you don't even have to go to a destination to kind of like say physically, I'm leaving it there, but it's
Yeah.
your home makes it even harder sometimes to, create that boundary. But I think you gave us some really practical things. Um,
Yeah.
Not everybody has the flexibility, but as we get better in our field and we start to have that flexibility and things are starting to get, you know, we have more responsibility. then we could think about doing some of those things as well. I think that was helpful. So let's go back to the question we left off. What is the most rewarding part of your work? And so maybe you could tell us about like what was the most rewarding part when you were just the director before, now as like entrepreneur part. What is rewarding about that?
So starting with not just as director, like being in the field as a therapist itself, I would say the most rewarding part is seeing growth in my patients. A client that I started working with, and a year or two later, I could see like they independent, they don't need me anymore. And I remember back in school, in grad school, a professor told me a great therapist's job is to literally work yourself out of a job. So it's to get to the point where your client don't need you anymore. So that's definitely a great reward for me. And I know one of the things I love is when I run into my clients. I mean, I live in Boston. Boston is small. So I run into my clients more than I would like to sometimes. And I could be in the grocery store and a child runs to me and hug me. And I'm like, okay, when did I see this kid? Like, do I know this kid? And I have to remember the client. But not too long ago, maybe about 2 weeks ago, I was at the grocery store and then this tall young man came and hugged me. And I'm like, I remember this patient. And his mother was with him. And I'm like, oh my God, I was working with this kid when he was 10. And when I had started working with him, he was like getting suspended all the time, serious behavioral issues in school, was dealing with a lot of trauma. And now he is 16. And to see him at the grocery store and him remembering me and coming and hugging me and telling me, oh, I got my license now. And I'm in high school, I'm doing well. And mom is like, we still talk about you in our family. Like, you still like such an important part of our family. And till this day, I will get referrals and it'll be that mom referring clients to me. So to me, it's like, that's definitely one of the major rewards.
That's amazing. That's definitely amazing. This made me think, is it easier or harder or more difficult to work with younger patients or with older patients or with like couples?
So my primary preference is couples. I love working with couples. In fact, no clinicians in my practice enjoy working with couples except me. So majority of my caseloads are the couples because no one else wants to take the couples. And my least favorite are children.
Wow.
I prefer couples and then adults and then children. And the truth is, a lot of time when I'm working with children, I feel like the parents is the one that needs the therapy and not so much the child.
Yes.
And I feel like, okay, I'm working with this kid, but how can I expect much change in the child if things are not changing at home? If the parents is not open to accept their responsibilities to why the child is acting and behaving a certain way. So that's my frustration as to why I don't enjoy working with children. I have worked with some children where I have some very active parent, like this child I just mentioned earlier. His mom was a very active parent. I find working with children who have parents that are active, that are willing to make changes and accept that, okay, what can I do as a parent to help the situation?
Right.
Great.
Mm-hmm.
But unfortunately, for most part, a lot of time I work with children where the parents feels like, I'm not involved. This is not about me. I'm dropping off my kid in your office for 45 minutes and I'll pick them up. And that frustrates me. So therefore, I don't take children. I personally don't work with children. I have other clinicians through my practice that enjoys it, and I'll gladly send them the referrals. But I have a very hard time working with children because of that.
I get that completely, totally, because you're right. The kids have a limited amount of agency over themselves and their bodies and their environment. And so, what you give them as strategies, if nobody's reinforcing it, or if the parent actually goes contrary to what you advise them to do,
Yeah. And
Headache.
there's no point. It's like, what's working?
Yeah, that could
Yeah.
be headache. All right. So if you could do it all over again, would you choose the same path for yourself? If not, what would you do differently?
Um, yes, I would. I think there are times where I was like, oh, I should have gone to become a psychiatrist and go to med school. But that's only because I know they make a little bit more money. and and there are not a lot of Black psychiatrists out there. Um, and I've even thought about going back to become a nurse practitioner just to be able to prescribe if necessary for my patients. Um, but other than that, it doesn't matter which field. I think I would still end up being in the human services field and counseling.
Okay, that sounds good. Sounds really good. So you've already given us some really good nuggets about, the differences between the fields and, um, which one gives you more flexibility. If you were to give any advice to any young person or even somebody changing careers, who was interested in doing what you do as a, licensed social worker, doing psychotherapy, what advice would you give them?
I would say first do your research. Because as I mentioned, the field of social work is so broad and there are so many options. Finding out what exactly it is that you want to do within the field. And that's important because every school of social work is different. So once you know what exactly you want to do, doing that research and finding out which school caters to this. So, for example, I attended Wheelock. Unfortunately, Wheelock no longer exists because BU bought them out.
Yeah.
Um, but when I attended Wheelock, the focus was children and families, and it was all clinical. Um, and I entered the field not knowing all my options and not knowing that the social work, like different schools offers different things until after I graduated. Now, granted, with what I have from Wheelock, I can always jump ship and go to different areas in social work. But if there's a certain area that you really want to do, you want to do your research. Some schools, like Simmons, has programs specifically for if you want to work in the community, if you want to work with people of diverse cultures. They have programs if you want to become a CEO of a nonprofit
Okay.
that specifically have certificates to go with that degree, like that part of social work. Um, BU has an entire macro social work program. If your role as a social worker is to run a company as a social worker, if you want to be more management level social work, so the macro program at BU focuses on that. If your goal is not to be therapist, is not to do clinical work, you can be a macro social worker. BU also have an international social work program. Um, if you want to be a social worker in a different country, um, and those students get to travel to like Africa and other countries throughout, like as part of their programs. Um, so it's really finding out what it is that I want to do as a social worker, because just because you're a social worker doesn't mean you have to be a psychotherapist. Um, and if you want to be a medical social worker, figure out which school is best for that.
That is great advice. And thank you for being specific about schools, about the types of programs. And I would have to agree. I think, research, talk to somebody
Mhm.
who's doing it, ask questions, ask lots of questions. Like they said, there is no stupid question. I really believe that.
Exactly.
Um, so I'm glad we were able to talk and hear about your journey and about the work that you do. Before we end, I would like to offer you some time to tell us about how people can reach you, And basically, like, how do you get your clientele? Do people reach you directly, or how does that work?
Yes. So I have a Facebook page and an Instagram page. And both of them are under Personalized Interventions. That is the name of the practice. And I also have a website, www.personalizedinterventions.com. You can find me on that. And also, if you go on Psychology Today and type in personalized interventions, there'll be informations about us on Psychology Today. So those are the best ways to find us and reach us.
Awesome. Awesome. Thank you again. And I hope that this helps. I know it will help somebody who's thinking about possibly going into the mental health field. And even if the person is thinking about just reaching out for their own care, now they know of somebody who looks like them, who believes the things that they believe in, that can help guide them through that. So thank you again, Liz, for doing this with us. And God bless you, and may God continue to grow your ministry, because that's what it is. You're serving people, and, grow your business and the work that you're doing, and your family. Can't leave out your family.
Thank you. Yes. And thank you for thinking of me and inviting me to do this. Appreciate it.
All right.
All right.
Bye.